at Cleveland State. And we had the opportunity to talk to a number of the volunteers today and others who have been working. Very exciting. We're also seeing a lot of walk-ups today, so that's a good thing. I'm wearing a tie from the Football Hall of Fame, of course, in Canton, and I'm doing that because in 2 days the NFL draft comes right here to Cleveland, and so we're very, very excited to be able to host the NFL draft. So I have an announcement today in regard to quarantining. As of today, 4.6 million Ohioans have had their first dose. 3.6 million Ohioans have had their final dose. They're fully vaccinated. 3.6 million of our fellow citizens are now fully vaccinated. 4.6 million have actually started. So we're moving forward. This vaccine is extremely powerful. It is extremely effective. It gives us a lot more freedom. When we talk to people who've been vaccinated, that's the first thing that they generally say. I'm going to be able to do this or that, and I'm happy about that. So powerful, very effective, certainly gives us a lot more freedom. After consulting with Dr. Vanderhoff, as well as other health experts, I'm announcing today the following change in our quarantine protocol. Ohioans, beginning today, who have been fully vaccinated, no longer will have to quarantine if they are exposed to someone who has COVID. So again, Ohioans, beginning today, who are fully vaccinated, will no longer have to quarantine if they have been exposed to someone who has COVID. The power of this vaccine allows us to do this. I know that, for example, high school students, high school athletes, high school students who are in extracurricular activities, maybe not be athletic, it might be theater, it might be any number of other things. One of the things that's been very tough for them this past year is that if they were exposed outside the classroom to someone, they had to quarantine. And we've had our students that have missed big athletic events, might be missing a debate, might be missing some other extracurricular activity. And we know that's been very tough on them. Today, of course, we can vaccinate. 16-year-olds can get vaccinated and 17-year-olds can get vaccinated. In fact, I looked at the numbers just a moment ago. We're up to now 21%. Over 1/5 of those 16 and 17 years of age have now been vaccinated in Ohio, at least having their first dose. We believe further that it won't be too long until those 12 years of age and older will be eligible to be vaccinated. So by changing our health order, which we are doing today, these young people who are vaccinated will be able to participate in sports. They will be able to participate in other activities, even though they may at some point in the future be exposed to someone who has the COVID. This change will also apply to adults as well. The only exception being those who are in nursing homes, those who are in assisted living facilities or other kind of care settings that are outlined in the order which we are issuing later today. Nursing homes and long-term care facilities should continue to quarantine following CDC guidelines. They are governed by those CDC guidelines. This includes quarantine staff and residents who have been exposed to COVID-19 and residents, of course, upon admission. Again, CDC guidelines are what prevails there. And just to remind everyone, a person is considered fully vaccinated if they got J&J. It would be 2 weeks after they got the J&J vaccine, the Johnson & Johnson. If it is Pfizer or Moderna, it would be 2 weeks after their second dose. That is what is considered to be fully vaccinated. Vaccine is our ticket out. It's our ticket back It's our ticket to have more freedom. It's our ticket to go live our lives. I think this change, I hope this change will encourage more students and more of our young people to get the vaccine. So I said we return today to the Wolstein Center on the campus of Cleveland State University. Fran and I had the opportunity to talk with some of the people who are getting vaccinated. It was exactly 6 weeks ago that we stood here with our partners from FEMA, from Cuyahoga County, from Cleveland State University, from the city, to officially launch this mass vaccination site. It has been phenomenally successful. Since then, the team here has put 237,000 first and second doses out, a total of 237,000 second doses of the first and second doses of the Pfizer vaccine. The operation of the site has been truly a well-oiled machine, been phenomenally good. Eric, let's pull up that time lapse if we could. We showed this to you a few weeks ago, but it's worth showing again. This is a look at the process to get people in and out the door. Over the last 6 weeks, the team has moved approximately 6,000 people a day through the clinic. We are now in the 7th week. So during this week, week 7, and next week, week 8, we are offering first doses of the Pfizer vaccine. Vaccines will also be offered during week 9. We're not sure what vaccine that will be. And then we will have corresponding weeks for the second doses here as well. So we've actually extended the time that this site will be operational. Weeks 10, 11, and 12 will be reserved for the second doses. One of the things that Fran and I saw today is a lot of people who just literally walked in. And this site is now open. Anyone could go online. There are plenty of vacancies. You can schedule an appointment, but you also can just show up here. And I asked several people, how did you decide to come today? And the answer back was, I don't have a computer, wasn't able to schedule it, but I heard it on TV, or I heard it on radio, or read it in the newspapers. I saw it in the media, and I knew it was available, and I made the decision this morning to come get vaccinated. So they're open for business. We're certainly very grateful for Cleveland State University for hosting this. This has been a major, major, major undertaking. They've done an absolutely phenomenal job. Cleveland State University President Harlan Sands is here with us again. Mr. President, thank you again for your hospitality. Your team has been absolutely phenomenal.
Thank you, Governor. Thank you, Governor, and thank you for joining us, all of you, for joining us here at Cleveland State University today. It's a privilege and a pleasure to share this stage with you, Governor DeWine, and our other esteemed guests to announce news about extending our successful mass vaccination clinic here at Wolstein Center. Governor DeWine, thank you for your continuing leadership as a proud Ohioan and a representative of our faculty, staff, and students at CSU. I wanted to take this opportunity to say thank you, not just for the mass vaccination effort, but for everything you've done to lead us through this pandemic. The success of our mass vaccination clinic is a true testament to the power of how federal, state, and local agencies and organizations can affect the public good. For all of us at CSU, serving our community in this way is central to our mission as an urban university, and it's part of our DNA here at Cleveland State. As feedback from our community has confirmed, and you just mentioned, our clinic has operated incredibly smoothly. I can't tell you how many emails, calls, other communications I've received praising this operation, not only for how well it's been run, but for the friendliness and the warmth of the volunteers and the workers, many of which are here in this room today. So let's do everything in our power to get everyone vaccinated so we can turn our arena back over to our Horizon League champion, CSU Vikings basketball team, and all of our sports teams. We look forward to working with the Vaccination Center in the coming weeks and months. Thank you, Governor.
Thanks, Mr. President. We really appreciate that. Just again, a reminder, beginning today, the clinic is also accepting Walk-ins, prior to today, appointments were required. You can still get an appointment, but if it's easier for you to just stop in, you can do it from 8 o'clock in the morning until 7 o'clock at night. 8 o'clock in the morning to 7 o'clock at night. Otherwise, we still encourage citizens to book their appointments at gettheshot.coronavirus.ohio.gov or 833-4-ASK-ODH. To put this in perspective, we now have more than 1,900 vaccination locations in the state of Ohio. These include health departments, pharmacies, pediatricians' offices, primary care physicians, fairly qualified health centers, and other retail partners. Right here in Cuyahoga County, there are 136 separate sites in addition to this site. That does not include the pop-up vaccination sites that have been held in Maple Heights and will be held this week at Elizabeth Baptist Church and at Good Shepherd Baptist Church here in Cleveland. We also know that there has been a downturn in the number of people who are asking for the vaccine. Some of this was inevitable, as we now have 40% of the population that's already been vaccinated. If anyone has been waiting, I would just say now is the time to come. Now's the time you can get in. Now's the time you can get the vaccine. Now's the time to get this ticket to enable you to do more things and to move forward. Let me now bring in Dr. Carol Cunningham. She's our state medical director for EMS. She's also one of the medical directors for the Mass Vaccination Clinic. Some of you may remember seeing Dr. Cunningham and hearing her. She even got her first dose of vaccine live on the air with us back in December. So, Doctor, thank you very much for joining us. And what are you seeing out there? How are things going?
Things are actually going well. We just need to get more people out to get vaccinated. First of all, it's been such an honor to be part of this collaborative effort. As I speak with my counterparts from other states, the state of Ohio has just really excelled in their efforts to get vaccinated and to make all these opportunities available. For the EMS community, thank you for allowing EMS providers to be vaccinators. We've been a significant part of the manpower. There's been a lot of enthusiasm with EMS helping out with the state and local clinics. Certainly, I'd love to have everybody come to the Wolstein, but just go and get vaccinated at the center that's closest to your home. I received my first vaccination on December 23rd and my second one in January. At the time of that briefing, I had one of my EMS providers was deceased from COVID. And just in that short period of time between then and today, I now have 5 personal friends that have lost their lives to COVID. And it's tragic. My friends who have recovered are still having some long-term effects, chronic fatigue, chronic headache. So I can't urge you enough to go out and get vaccinated. From a statistical standpoint, we're still seeing 40 to 60,000 deaths per month nationwide from COVID. Unfortunately, again, the demographics have changed. We're seeing younger patients who are getting COVID, but still the largest percentage are of persons of color. This is a great opportunity to protect your health, protect your long-term quality of life, and also to protect others. On a personal note, since I've gotten mine, I feel a whole lot relieved being around family members, being around friends. As the governor has mentioned, it is our ticket to get back to normal. I would be remiss in saying that although we're looking forward to the draft, and I know you support the Hall of Fame. I'm a native Clevelander. One of the pop-up clinics was at my hometown in Maple Heights, so go Mustangs. But I'm a lifelong Browns fan, and I know that number one, now that I'm fully vaccinated, I'll have the freedom to take that vacation to the Caribbean and actually leave the country. More importantly, I'm looking forward to going to a live concert And after the draft is over, I want to see the dog pound filled with vaccinated patients and no paper fans as we root ourselves to Super Bowl 2022. Thank you.
All right. On that very happy note, Doctor, we appreciate it very, very much. It is the vaccine is our ticket to do all kinds of things, whatever we love to do. With us now is Claudia Longo. She received her first and second doses of vaccine here at the Wolstein. Since then, she's been helping to spread the word about the importance of vaccinations, particularly to the Hispanic and Latino communities. Claudia, thank you for being with us. How you doing?
Very good. Thank you. Thank you, Governor, for being here. And yes, as you have said, I had already my 2 doses. Actually, everybody in my household had their vaccination here at the Wolstein, including my 16-year-old son. So I've been here already 4 times, 2 for me, 2 for my child. And I can say it's been such a easy experience coming here. From getting to the place, it's so easy, it's very accessible. If you come with your car, you have 2 parking lots. Everything is for free. You can park it and walk to the building. The building, as you walk in, everybody's greeting you with a smile, and the place is filled with people that is here to help you if you have any questions. There's translators too. I don't know if people know that. So if you don't speak English, you will always find someone here that can help you. Then it's so easy, so fast. And the volunteers and the National Guard are very, very gentle and kind. Everybody's here to help. So I encourage everybody to come and get their vaccine now that it's so easy. You don't have to even make an appointment. You can just walk in. You can take your lunch break and come, or after work, weekends too. So it's going to be really easy. And I encourage the whole entire Latino community to do it. It's easy. So if you allow me, and I would like to say this in Spanish.
You do that. Thank you.
So they can get it. So I promise I'm going to be nice. So a toda la comunidad latina de Cleveland, los invito a que se animen, que vengan al Wolstein Center, que es un lugar en donde va a ser muy, muy fácil obtener su vacuna para el COVID, para que estén protegidos ustedes, su familia, su comunidad. Es muy fácil acceder, pueden venir con sus coches y parquear, el parking es gratuito. También hay transporte público muy fácil para llegar, también hay acceso a transporte gratuito, que lo pueden buscar en la página del gobernador. Y bueno, los invito a que lo hagan, que se animen, es muy fácil, es muy rápido, no toma más de repente media hora. Todo el trámite y van a ver que vale la pena. Very good.
Thank you very much. We appreciate that. Well, as Claudia said, Wolstein Center has translators, Spanish, French, Russian, Mandarin, Arabic, and American Sign Language. And Fran and I had the opportunity to meet all of them and just to thank them for the great job that they're doing. And what they tell us, of course, is when someone comes in and they can speak the language, when English is not their first language, and someone can talk to them in their own language, it really makes a big, big difference. Site is also ADA accessible. There are also accommodations for those who have sensory or privacy needs. Parking's free, as Claudia said, and if you need help getting downtown, transportation is free as well. Ask now Health Commissioner Terry Allen joining us today. Terry and I talk every week, tells me what's going on and gives me a report. Terry, you might want to talk a little bit about the transportation, because I know you've been involved in that a lot.
Thank you, Governor, and thank you for the time you spend with us. I think since the beginning, once a week, listening to the challenges that we've had at the local level, and your support has been very much appreciated. We appreciate your support also for extending this mass vaccination site here in Greater Cleveland for our community, in conjunction with the Ohio Department of Health, our friends at the Ohio Department of Health, the Ohio National Guard Emergency Management, the great partnership with FEMA, U.S. Department of Defense, the City of Cleveland, Cuyahoga County, and of course, the support of President Sands at Cleveland State University. Thank you. The additional month here at Wolstein really represents a welcome extended opportunity for all of us to get the shot, to save lives, and keep people out of the hospital. If you haven't been vaccinated yet, we ask that you please take advantage of this valuable asset in our community, right here at Wolstein. And as Governor DeWine noted, we have transportation assistance available, courtesy of County Executive Armin Budish and the Cuyahoga County Council. They're providing through just calling 211, just 3 numbers, 211 for transportation assistance with options including free RTA passes, rideshare services, and rides through Senior Transportation Connect and our local churches. And I want to take a moment to acknowledge the incredible support that the faith community has provided and the support from the foundation community to urge congregations to come to Wolstein to be vaccinated and the importance of protecting their congregations and family members. So there are a few points I want people to consider. Since we have Dr. Cunningham here, I think it's important note to share that more than 95% of doctors who have been offered this vaccine have gotten it as soon as they can. As soon as they can. It's wise to follow your doctor's advice, and so it makes good sense to follow their example. As we all know too well, many people have suffered greatly in this pandemic. Many jobs have been lost over the past year. The more people we vaccinate, the sooner we can get people back to work. And that's important for our local economy. It's important for the state. I also know that it's important to recognize that we've all lost people in our workplaces, in our families. And I remember the difficult spring we had at the beginning, the difficult challenges we had in the winter. And those should urge us all to remember those moments and be a calling for us to come in and get vaccinated, because those were tough times. So there are several reasons why people get vaccinated. I was at a clinic on Saturday. This past Saturday, we do lots of clinics. And a gentleman came up to me and he walked in for an appointment. And he looked a little sheepish. He wasn't sure that he wanted to be vaccinated. So I asked him, why did you come? And he said, I'm doing it for my mother. And that's a big reason why I chose to get vaccinated, certainly. Not just as a public health professional, because I wanted to protect my mom and my father. With Mother's Day just around the corner, what better gift to give than to your mom than to get vaccinated against the virus and protect her and all your loved ones. It's the gift that keeps on giving. And if you plan to catch a game this week, just know that just around the corner is Progressive Field, and the Tribe is amid a long homestand. So we're just down the street there. We were treated to a walk-off homer last night to win the game. And so if you plan to catch that game this week, why not come down early and come to the Wolstein and get vaccinated? It's quick, it's easy, and it makes good public health sense. And finally, and most importantly, if more people get vaccinated, we can save at least 100,000 lives of Americans, 100,000 lives of people who would otherwise die from COVID. And what could be more important than that? Thank you, Governor.
Sir, thank you, and thank you, the county, for what you all do. Great, great, great job. Again, we're offering the Pfizer vaccine here at Wolstein. And again, that is the vaccine that 16-year-olds and 17-year-olds can take. We ask the parents to look at this as an opportunity to come downtown, go to the Wolstein Center for your kids to get vaccinated. We're also working to finalize details on a partnership with Cleveland City Schools to bus 16 and 17-year-olds here who have the consent from their parents to get vaccinated. I hear every week just some amazing work that's being done in the counties and the cities across this state to reach more and more people with this vaccine. Here are some of the things that we've seen happen. Cleveland Indians game. We've had workers at Progressive Field vaccinated. Workers at Progressive Field signed up those working at the ball game, fans for appointments right here at the Wolstein Center. In Wood County Public Health is launching a new vaccination on demand program. Our county residents can call the health department. They can provide an address and the number of people and the people who would like to be vaccinated. And the department will send someone to that address to administer the vaccine. You can't get any more convenient than that. In Franklin County, These are just a few examples. It's a partnership we've talked about before with other school districts, but clinics at 4 area high schools began Monday for Columbus City school students who met the age criteria. The school system is providing transportation and is working with Columbus Public Health and Nationwide Children's Hospital. And the district hopes to administer 6,000 doses. Mahoning County and the Youngstown Health Department have partnered with Just in Time, a community ride and resource agency, and WRTA, the local mass transit provider, to provide free round-trip rides to individuals to get their vaccine. So there's just a few of the examples. I just talked about some of these unique efforts that our local health departments and businesses are taking to encourage vaccinations. I want to share a video that the team at the Erie County Health Department created to encourage minorities in the community to get vaccinated. The video acknowledges why there may be a hesitancy to get the vaccine, but also reminds people why it's so important that each of us take it to protect our families, our friends, our neighbors, our community. Let's take a look.
We each have our own individual journey. Along the way, the past can loom large like a mountain in the distance. It can feel impossible to overcome. Wherever we go, our road is filled with miles and miles of reminders from a past filled with pain and manipulation. I understand why you might feel a little hesitation.
But as a medical physician, I know what I can trust.
You see, science has come so far in such a short amount of time.
There's no bias, there's no prejudice.
There's no learned behavior when it comes to the actual science.
It's about recognizing that this is a moment of hope for all of us.
And though the past can loom large, now's the time to focus on a healthy and full life.
And not the mountains of our past.
Think about your family, your children, your future.
And go to coviderieohio.com
And sign up for your protection against COVID-19.
It's the simplest way we can protect you and everyone you love.
I was vaccinated for my family, my friends, and my community.
I got vaccinated for my community and for every single student in my district.
I was vaccinated for my patients and my kids.
I was vaccinated for you.
Well, that's very strong. That's great. As part of our efforts to make COVID-19 information and vaccine information accessible to all Ohioans, including those with disabilities, we are announcing a new project with the Ohio Department of Health with opportunities for Ohioans with disabilities and community centers for the deaf across Ohio. The community centers for the deaf are taking turns translating important COVID-19 vaccine guidance and information into American Sign Language. These short video segments are now available on the coronavirus website. That's coronavirus.ohio.gov, coronavirus.ohio.gov, and look for the Equity and High Risk Groups tab in the Communications Resource Hub. We're certainly glad to make this vital information available to more than 303,000 Ohioans who are deaf, hard of hearing, and are grateful to all who have worked to make these resources possible. Eric, let's go to look quickly at today's slides. So we start off, we see our cases. We always like to see our cases lower than the 21-day average, so we've plateaued out and we're starting what we hope is a downward trend. We'll have to see, but we seem to be moving in the right direction. Well, I'll show you a slide on that a little bit later. Let's look at the next one, Eric. Again, this is the indicator. If you want to see how widespread it is in your county, this is the indicator. All 88 counties listed in order. Let's go to the next one, Eric. Lucas County, Erie County, Cuyahoga County, those are the three top counties today. Counties by high incidence of the virus. So that's what we're seeing. It is worse in the northern part of the state. We've talked about that before. We continue to keep an eye on what's going on in Michigan. So even though 40% of us have been vaccinated, we're moving, we still have a virus out there that is very, very, very contagious. So I asked our team to put this slide together. This is from the first of this year, from the first of the year. You can see where we are today. So what you've seen has happened. You've seen we went down for quite a while, then we started up, and it would appear that we are now on a downward trend. We're headed that way at least for the last few days. I had them also look at the last 13 days, last couple weeks, and just put those out, and you can see the numbers. This is per day, what we're seeing, just registering per day. And again, we're moving in the right direction, so that's good. So this is our cases, our vaccines that have been started, and we take a look at that. These are the first doses. As you can see, we're getting close to 40%. We hope to be at 40% very soon. Numbers, of course, per day. We're always low on Tuesday, coming off of a Monday and weekend, but this is obviously a lower figure at 20,000 than what we have been seeing. So let's go to the next slide, Eric. And this is second doses completed, and again, you can get an idea of what we're doing there. Second dose is 42,000 for the last day. And I want to go through a couple of these slides in regard to the age, because I think it's interesting to look at the age group, if I can find it here. Yeah, here we go. So if you look at the age groups, I had our team pull out just to take a look at it, exactly where we are. And what we will see is a continuation. If you look at the age, we are now fast approaching 80% for those 70 to 74. So we're doing very well with over 65. If you look at from 65 up, we're well into the 70%. And, we're not doing too bad in the other age groups as well, but we just have to keep moving as we move forward on those. Thanks, Eric. And our hospitalizations, again, get an idea of where we are. Hospitalizations, of course, are a lagging indicator. So we would hope that those in a week or two will start getting even better. Let me now go to Dr. Vanderhoff. I want to bring in our medical director, Dr. Bruce Vanderhoff, to talk about what we're seeing in the last week. Doctor, you want to give us an update?
Thank you, Governor. Well, as you've noted, vaccination is our key to putting this pandemic behind us, and we're actually seeing the benefits of vaccination playing out on the world stage. The UK, which faced an unprecedented wave of illness and hospitalization this winter, driven largely by the dominant variant in Ohio, B.1.1.7, now has vaccines in the arms of more than 70% of its people, and as a result has driven COVID numbers very low. Much of Europe, which was behind, is catching up with vaccination, and as a result is now beginning to turn the corner there with its own variant-driven surge. Again, thanks to vaccines, in their case now reaching about 30% of their population. But now also in India, which has to contend with the challenge of vaccinating a vast population. The variant has caused a sudden rise in cases from around 80,000 a day in early April 1st, to well over 300,000 cases daily now. So simply stated, research and facts on the ground are telling us that vaccination is a powerful weapon against COVID-19, even in the face of the new variants. First, because the vaccines protect us with immunity that we now know is strong and lasts. In fact, recently reported 6-month data from Pfizer's phase 3 trial confirm that the vaccine remains highly effective over time, even against the variants. And other research now suggests that vaccination boosts protection for those who may have some level of natural immunity because of a past infection. Not only does a growing body of evidence point toward the vaccine's ability to prevent disease, but also the transmission of disease. And the CDC in considering the place of vaccines and getting our lives back to normal, has acknowledged the potential benefits of doing what we're doing, relaxing even the post-exposure quarantine requirement for fully vaccinated people. So being vaccinated is truly the key to getting our lives back from a virus that continues to find new ways to inflict suffering and death. Vaccination is the shield that lets us plan on the things we want to do, whether it's our sports season, band or orchestra season, theater, social events, etc., as the governor noted. So we're making real progress. We're seeing that over the course of the past week. The world stage is showing that same picture tied to vaccine, with vaccination being the key to dropping COVID infection and hospitalization rates, despite the threat of a more infectious virus that continues to attack unprotected people all over the world. Thank you, Governor.
Doctor, thank you very much. Lieutenant Governor.
Thanks, Governor. It's great to see you in Cleveland. I know the eyes of the football world, at least, will turn to Cleveland on Thursday. I will be one of those eyes, or pair of eyes, that will be looking. And I loved how Dr. Cunningham predicted that the eyes will be back next year as the Browns win a Super Bowl. So her optimism was fantastic. I also know, Governor, from our conversations with the coaches and athletic directors around the state, that student athletes around all of Ohio will be excited to know that with the vaccine they will no longer be required to quarantine. That's welcome news to them as they enjoy the rest of their spring season and then head into summer and fall. But I also, what I want to talk about today is, I know how everyone loves a good statistic, and we have several of them to discuss today. Most importantly, I want to talk about how these statistics shape, how we can shape these numbers to the benefit of all Ohioans around the census, unemployment, job creation, and the workforce. Census data came out yesterday showing Ohio's population at 11,799,448 people. That's up 2.3%, 262,944 people from the 2010 census. So we saw an increase in Ohio, which in the Midwest is not something we're seeing that dramatically. Ohio still being the seventh largest state in the country. But what struck me was how the census statistics were predicting a much lower number for Ohio. They were predicting 11,693,000, which was more than 100,000 people lower than what we actually ended up being. And so it appears that efforts in recent years to recruit and retain Ohio's workforce, our people, is at least temporarily working. We don't know how much COVID affected that in the 2020 numbers, but what we want to talk about is how we make that more permanent and things that we're doing to grow that workforce and population, because we need it. We're at our unemployment rate in Ohio in March was 4.7%. That is below the 6% national average. And employers, I hear from them every single day, employers are having a difficult time finding, to hiring new people or getting employees to come back to work. And that's why it is very important that everybody who wants to get vaccinated, that wants to come back to work, that they know that it's easy to do. There are appointments going wanting right now. That it's possible for everybody who wants to get vaccinated to easily get vaccinated by the end of May, if they want to. And presently, just to put this in perspective, we have over 180,000 jobs available at Ohio Means Jobs, nearly 93,000 that pay over $50,000 a year. I emphasize this conversation because I know that Jobs Ohio and our economic development team have many employers looking to Ohio for expansions right now in 2021. And I can't emphasize enough how access to a quality skilled workforce is to winning these deals, winning these expansions. You can't create a job until you have somebody who's qualified and prepared to take that job. So we need that workforce. And We have training, I want to emphasize this as well. We have training programs available that can give you the skills you need to be ready to go to work in an in-demand, higher-paying job in a month or less. Yes, from the time that if you decided you were going to go get vaccinated and you wanted to be vaccinated by the end of May, we can literally train you through many of the programs we have with these in-demand credentialing programs for these jobs that pay more than $50,000 a year. We can do it in less than a month in many cases to get you prepared for some of these in-demand jobs. We talk about this all the time. Tech Cred available for you right now. Go in there and find the in-demand job trainings that we will work with your employer to pay for at techcred.ohio.gov. The individual micro-credential program at imap.development.ohio.gov. These training programs can get you trained for these jobs that are available that pay well, and we can do it in less than a month in many cases. Our administration has championed career technical vocational education and training to help tens of thousands of more Ohioans a year get quality, good-paying jobs without the high cost of a college education. But remember, many of these credential programs also, the credentials come with college credits, so you can do both. And Ohio's community colleges are leading the way nationally in converting these career credentials into college credentials, so you can do an all-of-the-above approach. And so it brings me to a state budget related request. We need the legislature to fund these programs in the upcoming budget. We are asking for more. We want to set the goal of 70,000 high school students a year graduating with career credentials, and we will pay for the tests for them to earn these in-demand career credentials. And we are also going to create an incentive for more high schools to graduate more students with in-demand career credentials. We have $25 million a year that we're asking the legislature to fund in this area. We need them to do it. Additionally, with Tech Cred, we want to go from 10,000 credentials a year to 20,000 credentials a year. We need the legislature to fund that, as well as the same goes with the Choose Ohio First Scholarship. It's a STEM scholarship for Ohio high school students to stay in Ohio, go to college, and get their STEM credentials. Why do I emphasize these things? Because we know they work. We know it works when we keep Ohio high school students in Ohio, get them their college education or their career credential, and they will stay here and go to work as we partner them with many Ohio employers who need their skills. I want to show a graph. I think Eric has this. It's up. Shows how the percentage of U.S. graduates employed in the state after they received a bachelor degree from a credentialing institution, one of our institutions of higher education. If you get educated here, you're more than likely to stay here. It's very important. And I think we have another graph that shows Ohio is a net importer. See this, a net importer of college students. So we have more people going to college in Ohio than leaving Ohio to go to college, and we can use these tools, the process of connecting them with employers earlier through internships, co-ops, and the like, to keep that talent here. And I also want to mention that in the budget this year, we're asking for every high school student to have access to computer science classes and coursework. We're creating a guarantee in the budget for this to happen, for every student to have access to those computer science courses. Really important if we're gonna win the efforts to keep Ohio students and talent in our state. And I also must add, as another budget request, actually in legislation, broadband. We've talked about it many times, and having an inclusive recovery from this pandemic. We've been asking the General Assembly for 2 years to pass broadband legislation. The Ohio House has passed it. They included the money that we need as well, the $200 million to drive these programs, to get going, to help communities like we did with East Cleveland. I know you're in Cleveland. What we did in East Cleveland, we took some money that we had in Innovate Ohio, put it in the East Cleveland program. Well, we need to do this for the whole state, rural and urban areas, for people that don't have access to high-speed internet. We say and say again, you cannot participate in the modern education, economic, or healthcare systems without it, and we need this legislation to pass. The Ohio House did it. We need to get it through the Ohio Senate with the $200 million that we've requested so that we can do this. And Governor, I know that when we do this, that we are going to continue the economic momentum that we are building coming out of this pandemic, that has driven our unemployment rate down, that's helped keep more people here over the last year, and we need to keep this momentum going. Ohio has a bright future if we do that, putting people to work, getting them better jobs, giving them more job security, and giving employers the talent we need to be successful. So with that, Governor, I'll turn it back over to you.
Well, Lieutenant Governor, thank you very much. The budget that we presented is really an investment in our people. It's an investment in our infrastructure. It's an investment, calls for investment in broadband. These are things that will truly, truly make a difference, improve the quality of life, make us even more competitive. I'm very optimistic about our future. Investing and believing in ourselves, investing and believing in our own people is really what this budget that we presented to the General Assembly is all about. So I think we're ready for questions.
Governor, first question today is from the Wallstein Center, and it's from Maya Belay at WJW.
Governor, how are you? Good. So wondering, are you concerned that Ohio may have already reached the peak of vaccinations? What can be done about that? And also, can you weigh in on CDC mask orders?
Weigh in on what? I'm sorry.
The CDC saying that now you don't have to wear a mask outdoors.
Yeah, first of all, I don't think the CDC's comments today, I just looked through them very quickly before I came to the press conference. I don't think any of them are a big surprise. We know being outside is much, much, much safer. We know being vaccinated is much, much safer. So, you know, what they put out today, at least in a fast read, I don't think is any surprise. I mean, it doesn't change if we're in a crowded area outside. You know, we need to worry about that. We need to be careful about that. We need to have a mask. If we're out jogging, we're out walking, we're out by ourselves, you know, we're moving fast, you know, we don't need to worry so much about wearing a mask. As far as where we are is getting people vaccinated. Nothing about this pandemic has been easy. So no one should think that this was going to be easy either. But I think we are well positioned. Why do I say that? We're well positioned. We have almost 2,000 locations in the state where people can get vaccinated today. We have some very energized people at the local levels. You're seeing it here in Ohio County, but frankly, you're seeing it all over the state, who are doing everything they can to get vaccines out and to make it available to people. We are now moving. Most places now, you can literally walk in and get the shot. There are some people who that's just what they want to do. They didn't want to make a reservation. They didn't want to go online. Maybe they couldn't have gone online. They want to be able to walk in. And so I don't know what the numbers are now, but they were good numbers when Fran and I walked in here a couple hours ago about people just literally walking in. So it's going to be steady. We're going to have to keep battling forward, but we're at about 40%, and we just need to keep moving. If you look at the different age groups, you know, the most vulnerable among us, over the age of 65, we're at 73, 74% now. We've got one age group that will be passing 80% in the next week, probably. So we're not in a bad shape. We're in good shape, but we got to finish the job. We're like the Browns, and we're driving against the Steelers, and we're down to the 5-yard line, and we can't walk off the field now. We just got to gut it out. This is old-fashioned blocking, tackling, and just finish the job. So I'm optimistic, but we have to keep working.
Next question online is from Andy Chow at Ohio Public Radio and Television.
Hi, Andy.
Hi, Governor. Looking at the new data that the state's putting out on the county-by-county test positivity rate, you can see that some counties are as low as 1.7% positivity rate, and some are as high as 10.4%. Does this give you any thoughts about maybe moving towards more of localized health restrictions rather than statewide health restrictions moving forward?
Well, Andy, we don't have too many restrictions left, and I think that what's left is we've set a marker to get out of it. We're seeing our case numbers go down. We put them out every few days, and those numbers are now moving in the right direction. So I think it would not be a good idea to go to an individual county by county. We are impacted, obviously, by other states, but we're also impacted by other counties, and people move around a lot. So it just doesn't seem to me to make sense to do that. But I'm optimistic about where we are. But those figures are instructive, and what it tells people is, if they look at two numbers, if they look at how many cases per 100,000, where they are in the last 2 weeks, and that data is always with the last 14 days. If they look at that, and they look at the positivity numbers, that gives them a pretty good idea of what is going on in their county. And so I think they should take that information and inform themselves about what they do. And obviously, if you've been vaccinated, you're in a much better position than if you've not been vaccinated. So, I think we stay the course here. We keep moving. I'm optimistic. We're making progress.
Next question from the Wolstein Center is from Dan DeRose at WOIO in Cleveland.
Afternoon, Governor. Good to have you in Cleveland again. Good to see you in person. I want to go back to sort of this idea, how do we make more people get the vaccine or convince them to get the vaccine? Is it time to remind them of the punitive fact? Take the draft, for example. There are two sections of the NFL draft in town. There's the NFL draft experience, then there's the actual draft itself. And you cannot go to the draft itself unless you present your vaccination card. I'm assuming there's a lot of Browns fans who maybe have been dragging their feet about getting the vaccine, but when they found out they couldn't go to the draft in their own hometown, is it time that we remind people that there are going to be these punitive situations?
Well, there are situations where organizations like the NFL, for example, are making decisions, and they're making decisions based on science, and they're making decisions how to try to keep people safe. They have an obligation to keep people safe. So people are making those decisions. Organizations are making those decisions. But even putting that aside, for example, what we announced today, it's based on science. We looked at this and started thinking, really, is there any reason that these kids or an adult should be quarantined for 2 weeks or whatever if they actually have got a second shot and it's waited 2 weeks and they're now fully vaccinated? I mean, that's not fair. So when you look at that and someone looks at that and says, if I was doing it, I guess, I'd list on one side, I do this in my own life, I do it in government, what are the advantages, what are the disadvantages? It just seems to me the advantages of getting vaccinated, those are getting more and more and more and more. And, the science is clearly there. The scientists, the doctors will tell you that if you get vaccinated, your risk is a lot less than anything bad happening if you do get vaccinated. So they make that very clear. But if that's not enough for you, look at the different things you're going to be able to do. Or, again, in the example I gave, you're not going to have to be quarantined if you've been vaccinated. You're going to continue to see private entities make decisions, airlines make decisions, others make decisions based upon whether people are vaccinated or not. Now, that's not government doing it. That's not government. We're not doing that. But what we should do is when someone is vaccinated and there's really no great reason for them to be quarantined, we should make that the appropriate result, and that's what we're doing.
Next question online is from Scott Hallis of the Xenia Daily Gazette.
Hey, Governor. How are you?
I'm good, sir.
Good. Another question about getting more people vaccinated. I think it was last week someone posed the question of possibly tying in the removal of all the health orders to vaccination numbers and not the cases per 100,000. Given that the vaccination numbers are kind of going down and leveling off or whatever, could it be time to maybe continue think about, using the vaccination numbers to remove what's left of the health orders? I know you said you had been looking into it, weren't ready to announce anything. Is it maybe time to think about that since we're still a ways from the 50 per 100,000?
Yeah, we're certainly not ruled that out. We're still looking at that. I believe, like I said, there's nothing about this virus that's been particularly easy, and it's always unpredictable. But I have always felt, since we started this vaccine phase, that if we vaccinated enough people in the state of Ohio, cases would go down, in spite of the fact that we have a variant that's 40 to 60% more contagious. So I'm fixated on getting more and more people vaccinated, and I do believe that as we get more people vaccinated, you're going to continue to see these numbers go down. I liken it to putting money in the bank. Every person out there, right behind me at the Wolstein Center, here at Cleveland State, every person, when they get that shot, they're getting closer to that full immunity. And, I talked to some people who are getting a second shot today. That's banked. Now it's just a matter of time. You wait a couple more weeks and they've got the full immunity. So we're always lagging, as far as the cases. The impact that the vaccine has on the cases, there is a lag between that first dose, let's say it's Pfizer, first dose, and when you get the full immunity. And so you're not going to see the full effect, for 6 weeks or so. But every time we can do this, and so the battle is here, and the battle is getting more and more people shots. So I still think that this, target that I set at 50 is doable. I still believe it is doable. But we certainly will continue to kind of examine, what would be the figure that we actually have to get to. Part of that is complicated. It is complicated by the fact that no one knows exactly what herd immunity will constitute, and nor are we sure exactly how many people still are carrying immunity even though they're not getting vaccinated. So that's why it's difficult to come up with an exact figure of what percentage of the population in Ohio would have to be vaccinated before we would achieve that herd immunity. No one that I know has been able to tell us that. That's what's difficult about it. But what we do know is more vaccines are better, and we'll move in the right direction.
Next question from the Wolstein Center is from Jordan Vanderberg at WEWS in Cleveland.
Governor, I hope you're enjoying your stay in Cleveland today. Glad the weather could yeah, absolutely. Not the case on Thursday, though, unfortunately. My question is about vaccination rates. We're close to 40%. I think everyone in this room can recognize that's a big number. That's a good number. How much more difficult is it going to be to get the next 40%?
Well, I think it's like a lot of things in life. A lot of things you kind of divide in thirds. The first third is easy. In this case, the last third is really, really hard. But I liken it more to other endeavors that I might be familiar with, a political campaign. I mean, there are going to be people who are going to get the vaccine. We got to make it available. We did that. Most of the ones who, that were said, yeah, I really, really, really want it, most of them have already got it now. The ones who really wanted it. We got a group out there that's never going to get it. It's okay. That's their decision. We have the persuadable ones. We have the ones who are in the middle, the ones who, just for whatever reason, just haven't got it yet. Maybe have some hesitancy, not really sure what it's really going to, take to get them across. And Fran and I were talking to some of them. I mean, they didn't self-identify that way, but they hadn't got it yet. But today they decided, I'm going to go get it. And so what we have to do is make it available. We have to make it as easy as we can. And I think that when people see more of their friends get it and more of their family members get it, that persuades them. I can't tell you how many people, Fran and I have been to 36, 37 different sites around the state, and so many people say, I'm here, I'm getting it because of my mom, I'm getting it because of my kids. Had one man tell us that. I'm getting it because of my 16-year-old. I owe that to him to get it. So it's family, I think people are persuaded by doctors. They're probably more persuaded by their own doctor than somebody else's doctor, and they're persuaded by their family. So we're going to continue to get people vaccinated. I mean, every day I look at a figure. You know, the figure I looked at today was, what, 20,000, not where we wanted to be. That's still 20,000 that have started down that pathway, and they got a lot of, you know, they got the shot, and they're moving. So I'm still very optimistic, and we just not, you know, we're not going to get it as, in the next few weeks, we're not going to get as fast a rate as we have been getting it, but that's life, and our job is to make it available to people. I'm optimistic.
Governor.
Lieutenant Governor, I see
Yeah.
Lieutenant Governor on the screen.
I found what Health Commissioner Allen said earlier to be very compelling, because we know that there's this group of hesitators out there that they're like, yeah, you know, I'm probably going to get it, but you know, I'm still thinking it through. I think he used the statistic that 95% of doctors who've had access to it have taken it. I mean, the doctors have made, you know, they know more about this than anyone, and they've made the decision that by overwhelming margin that they think it's the right thing to do. And I just think those kinds of things, people want to have more information about it. We've been trying to get more information about it. They read these things, you know, about vaccine hesitancy over J&J and some of these other things. But when you talk to the people who are in the healthcare community, the doctors, they're getting vaccinated. I think there's a very strong, you know, action is louder than words, right? Well, the doctor's actions about getting vaccinated, I think, are pretty powerful evidence about what we should think about the vaccine.
Thanks, John.
Next question online is from Chelsea Sick at WKEF in Dayton.
Hi there, Governor.
Chelsea.
So looking at Ohio's mask order, it says people should be wearing a mask outdoors if within 6 feet of someone not in their household, but the new CDC guidance allows or recommends small gatherings outdoors with family and friends without masks for those fully vaccinated. Do you expect our mask orders to change here in Ohio after this announcement today?
It might be some change to conform to what they said. You know, again, I read it fast. I didn't see a major change. But certainly we have facts that are changing. We're having people vaccinated. And, you know, we put out those health orders. We did not have them vaccinated. So, again, I think the basic principles are the same. Masking is important. Outdoor is better than inside, a lot better than inside. And the vaccine is powerful. You know, those are kind of the basic things. I think if people remember those things, they'll be fine. They'll make their, you know, they'll make the right decision. You know, I think the CDC did recognize, and this is, you know, where you have to read into it or read it. But it, you know, if you're out and you're in a crowded area, you know, really crowded, you need to have a mask on still. You know, that's what they're saying. So it's kind of common sense, really.
Governor, you know, I'm looking at the synopsis of the CDC recommendations, and they're saying federal health officials said Tuesday that fully vaccinated Americans can go without masks outdoors when walking, jogging, biking, or dining with friends at outdoor restaurants. That's pretty much consistent with what our masking rules are already. You don't have to wear a mask when you're dining at a restaurant, particularly when you're outdoors. You just have, when you're going inside to your table, you certainly do. But I think that these guidelines are pretty consistent with what we're already doing.
Next question online is from Jim Oddie at WHIO in Dayton.
Governor, good afternoon. Had you considered an incentive following in the footsteps of West Virginia? It wouldn't have to be monetary, it could be something else. An incentive to get those people who are either on the fence or have not been paying attention to you so far, or just outright reluctant to accept the vaccine. Something else. What else could be done?
Jim, I'm asking myself that question and asking my team every single day, what else can we do? We know that some businesses are offering incentives to their employees. Sometimes it's cash. Sometimes it's other things. Sometimes it's 2 days off. You know, I know a lot of businesses are doing that. You know, we have moved to a different phase now. We still have, you know, more sites open today than we've ever had right today. but we also are going into businesses, we're going into schools and going to places to make it more convenient. So, you know, I think that everybody's motivated in a different way. I think when a business does some motivation, maybe some financial incentive, but also part of it, Jim, is a culture. You know, if you're working with other people and they're coming on the shop floor, or they're coming into your factory, or they're coming into wherever you are, and your friends are getting the shot, I think that is important. We're working reached out with labor unions and working with them to make it available to their members as well. So I don't think there's no magic bullet here. I just think our obligation in the state is to make it as available to everyone, as convenient as we can, to work with local communities who are really working very hard. I know, for example, in Montgomery County, they're doing a phenomenal job. The city's doing a good job to reach out to people, and we just have to continue to do that.
Next question online is from Laura Hancock at cleveland.com.
Hi, Governor DeWine. I was wondering, with cases kind of plateauing / going down, what is the latest, maybe Dr. Vanderhoff would know this, but what is the latest with the variants? How many have been detected, and how, what kinds of variants are being detected, that kind of thing?
Great. Dr. Vanderhoff, you want to take that?
Yes, I'd be happy to. So if you look at the state of Ohio, our numbers are reflecting those of the nation. B117 is leading the way. It is the dominant variant now in Ohio. 2/3 of the variants that are detected are consistently that variant, and it is literally leaving the other variants in the dust. That same picture is being seen not only throughout the rest of the country, but in some of the references I made in my earlier comments in other parts of the world as well. What's key about B117 is, as we've said before, and many of the other variants essentially mimic a lot of this, it is much more contagious. And it is so because of its ability to bind to the ACE2 receptor so much more easily. We've called that stickiness. And as a result, you do see people becoming ill with COVID-19 that we had not been seeing become ill before the arrival of B117. That's almost certainly because it takes less of the virus sticking to their receptors to get them ill. So that's the picture, and the answer to that situation continues to be, of course, our safety measures, but also increasingly importantly, vaccination, which is our shield against it and the other variants.
Dr. Vanderhoff, you had said in the past that you believed that the variant would become the virus. Has that happened yet? Sounds like it hasn't.
Well, that's exactly what's evolving. So what we're seeing is that B117, as it has done everywhere it has gone, is replacing the wild type variant, wild type virus as the new form of COVID-19, and in fact seems to outcompete the other variants in terms of spread, and that's exactly what we're seeing here in Ohio. That's what we're seeing in the country.
Thanks, Doctor.
The next question online is from Haley Nelson at WSYX in Columbus.
Hi, Governor. Thank you for taking my question. I wanted to ask about how things we see play out in other states, how that impacts you and some of the decisions that are made. I know in Tennessee, for example, the governor decided he won't be renewing any public health orders because the vaccine is widely available, and we see case numbers in states like Michigan. What kind of an impact does that have for you?
Well, I try to keep track. You know, one of the things about being a governor is there's 49 other governors out there making decisions, and sometimes, as in the case of the virus, we're all dealing with the same problem. It might be different stages. So we look all the time, frankly, to see what others are doing. You know, sometimes it's a case like Michigan where their situation is worse, and we worry about that, not only for them, but we worry about it for our neighboring counties, and Toledo in this case, and other counties in Northwest Ohio. So we try to keep track of what's going on in other states. And many times I will ask our team, what are we seeing in this area? If we have a question, if we have a decision to make, sometimes I'll text another governor. Sometimes I'll call another governor. So yeah, it's very important, and it's someone a long time ago referred to the states as the laboratories of democracy. Well, they're the laboratories, and as we, everyone's facing this common problem, different stages, but we learn from each other, frankly.
Next question online is from Jesse Palmer at the Cincinnati Enquirer.
Hello, Governor.
Jesse.
Looks like the CDC made some recommendations on fully vaccinated individuals and not requiring them to quarantine as early March. So I guess, why is Ohio making this change now?
I don't think too many states have made this. This is something we wanted to look at. CDC gave broad guidance. We looked at this thing and made a decision. This is what we should do. I mean, where we were seeing it, the most kind of gut-wrenching cases were with young people, 16, 17-year-olds who couldn't play in sports or couldn't do the play or couldn't do whatever they wanted to do. And so, we looked at it, we weighed it. Dr. Vanderhoff talked to other health experts, and we made the decision to do it. We are informed by what the CD says, but ultimately this is the decision that has to be made for Ohioans and has to be made by Ohio officials. But we certainly always look at what the CDC does. We also look at what other states are doing. Any experts, that's what we've done throughout this.
Next question is from Kevin Landers at WBNS in Columbus.
Hello, Governor.
Kevin.
Under the CDC guidelines now, fully vaccinated people can attend a crowded outdoor event like a live performance parade or sports event without having to wear a mask. What concerns do you have that more people are just going to stop wearing a mask whether they're vaccinated or not?
Yeah, Kevin, I didn't read it that way, but I won't argue with you because I read it quickly. Here's what I thought I took away from what they said. If you're out and you can maintain some distance, you don't have to wear a mask. But if you're in a crowded event, a whole bunch of people are out in drinking or whatever, and you're very, very close. We've all at one time or the other been in a situation like that. My understanding is that their recommendation is that you still have to wear a mask during that. But I think it does come down, though, ultimately to, I think people should just keep some basic principles in mind. If they keep some basic principles in mind, they're going to be fine. Outdoors better than inside, much, much better. The vaccine is extremely powerful. The masks are extremely powerful. And I think people can take those and kind of figure out what they're going to do based on the individual situation.
Governor, I want to just get to clarification on that as it relates to that question. It says the guidance also says unvaccinated individuals may go without mask when walking, jogging, biking outdoors, or with household members. However, officials caution that crowded outdoor settings still pose risks and urge everyone, both vaccinated and unvaccinated individuals, to wear masks when attending sporting events, live performances, and parades. So that's straight from the announcement.
Which is really kind of consistent.
So that's consistent with our.
Consistent with what we're doing, I think. So.
Next question online is from Molly Martinez at Spectrum News.
Hi, Governor. My question is, it seems like we're quickly approaching, if not have already reached the point where supply of vaccine is outpacing demand for vaccine. When we fully reach that point, how does our strategy change?
Yeah, good question. I see I put Regis to sleep again there.
Again, don't take it personally.
I know, I won't, but every time it's consistent. The folks back home can't see that, but I can see it. So, yes, we're there. We're there. There's clearly more supply today in Ohio, and I suspect most states, than there is demand. But there's still demand. And so I think what we have done is we have, in the last several weeks, spread this out to more places. I'll give you an example. We were hesitant for a small primary care physician because we didn't think they could turn them very quickly. And so early on, when we had a scarcity of that, it didn't make sense to do that and have them sitting in a primary care physician's office. And so, we went out to places where we thought they could move them quicker. Now, though, we know that there are people, or we think there are people out there who've not gotten it, but who would get it if their own primary care physician had it. So we have now sent the vaccine out to, I think, any primary care physician in the state that actually wants it. And so we've got, we're up to 1,900 locations. A doctor may go through, I looked at the numbers after 6 days, and we had some doctors who went through 50. Okay, but that's okay now because we have more supply, and we can allow it to sit there for a little while, assuming that doctor is getting 50 people this past week or last 6 days that we wouldn't have got, or he or she would not have got. So that's how it's changed. I mean, we're dealing with it, and while we want to get it in people's arms as fast as we can, we're not as concerned about it not going out within 5 or 6 days from that provider. If we can get it into a provider's hands who can reach people that weren't being reached any other way. So it has changed. We have changed how we're doing it in a sense. I mean, we really have built this, and we're layering it on. The other thing that's happened is, we had a number of providers last week who told us, don't send us any for this week because we've got it left over. And so, we listen to them, and they know what they're doing. So, but we're still getting people to take it. We're going to continue to get people to take it. I was excited about what I saw out there today. I mean, it's not going to be a huge number of walk-ins, I don't think, today, but we're in the hundreds of people walking in at the Wolstein Center, and those are people who didn't have the vaccine before now. So we're going to continue to keep this place open. We're going to continue to keep as many places filled up with vaccine that want it in the state, as many providers, and we're going to keep moving.
Next question online is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. My question is for Dr. Vanderhoff, if he's still on the call. How much does it help the state to have the Johnson & Johnson vaccine back in the mix here, especially when we're hearing that there are a lot of people who don't come back for their second dose? And then what would be your message to anyone who maybe is still feeling concerned about getting the Johnson & Johnson vaccine after we saw this pause?
Doctor, I'm going to take the first part of that, and then I'll turn it over to the expert, you. What we found, we didn't know, frankly, when Johnson & Johnson first came out, what people would think of it. But what we found was that there are people who really wanted that one dose. And judging anecdotally, but what I'm hearing from out in the field, there are still some people who want that one dose. Now, I don't know what percentage of those who wanted it before still want it. I don't know. But there are people who, there's a market for Johnson & Johnson because it's a one dose. And so the fact that in Ohio now you have an option of Pfizer, Moderna, Johnson & Johnson, that's a good thing. And it's a good thing for the consumer, and it's a good thing for as we try to move towards herd immunity because it gives people more choices, and more choices are generally better. Doctor?
Thank you, Governor. So I think the Governor summed that part of the answer to your question up very, very well, and there's really nothing that I would add to it. The other part of your question, though, in terms of the safety of the Johnson & Johnson vaccine, I think the ACIP, the Advisory Committee on Immunization Practices, both in its statements and during its voting session, really summarized that picture very well also. Look, the Johnson & Johnson vaccine is a safe and effective vaccine, and an option that many Ohioans might prefer. But the important thing that we now know is that there is a very small risk for certain patients who might be interested in it, and they need to consider that. The ACIP said people are smart. People are able to make good decisions for themselves. We have many medications on the market for which there is a small risk of the medication, and the patient is able to make good decisions about is the benefit largely greater than the risk, and in the vast majority of cases the answer there is yes. So I think that we've got a very good opportunity here in terms of our vaccinations. I feel very confident about the vaccinations which Ohioans now can access.
Next question online is from Jess Harden at MahoneyMatters.com.
Jess.
Hi, Governor. Thanks for taking our questions today. Some state and local advocates, education advocates, were disappointed that you weren't able to attend last night's town hall on abolishing HB 70. Where do you stand on returning control to local school districts?
Well, I made it pretty clear to the legislature, that we need to have a bill, but totally walking away and totally abolishing the whole procedure that we have now is probably not a good idea either. So, I think we've seen some of these schools do well. Some of them are coming out of that. I've had the opportunity to talk to different CEOs. So we're open. I'm very open to coming up with a new way of doing this, a way that where the state, before the school drops over the cliff, and goes into this category, that there are steps leading into that where the state can be of more assistance, the state can be more of help. That's what I think needs to be done. And I think there's a bill that can be passed, and that we can move forward and we can improve the status quo. But to completely do away with this simply says that we will accept as a state a situation where a school is failing and we will do nothing about it. And it seems to me that that is not what we should be doing, because it's not, it's not the school. This is all about those students. And so I think the focus should always be on the students. How do we help those students? And students are in a school that is not providing them with what they should be provided. Let's try to fix it. Let's try to help. Let's have the state do some things that can help. So it doesn't have to be what we have now. We can change that. But I don't think we can go to a situation where we just totally wash our hands of this and say, we're going to do away with all this and we're going to let these kids just suffer. And so I don't think that's not a responsible thing for us to do. So I'm still hopeful we can have a bill that will accomplish those things, those basic principles I just outlined.
Next question online is from Marty Schladen at the Ohio Capitol Journal.
Hi, Governor.
Marty.
I want to follow up on a couple of questions that were asked earlier. As we try to incent people to get vaccinated, would you encourage other businesses, venues, whatnot, to do what the NFL is doing and tell people if you want to come to this event, you got to show that you've been vaccinated?
Well, I think that's, government shouldn't get involved in telling them, that relationship between them and their employees. So we're not going to do that. Government's not going to do that. What I do obviously encourage is businesses to work with their employees and try to encourage them to get vaccinated. Economic incentives sometimes are good, but I think probably the most important thing is communication, where the people are given all the facts over a period of time, and they're given the ample opportunity to get vaccinated in a very convenient place for them. And that may be the workplace. So I think that's, we're seeing companies do that today. We would encourage more of them to do that, to make that opportunity available. And we're willing to work with them. If a company cannot find a healthcare provider to provide the vaccine, we will we'll find you a partner. We'll make the marriage. We'll put it together.
Well, I'm asking more about people who are holding sports and entertainment events.
And the question is about sports and entertainment what?
What about them telling people if you want to come, you need to be vaccinated?
Well, it's the same. Look, it's the same thing. I mean, these are private businesses, and you know, I don't know that the governor or state government should get involved in telling a pro anything team, you know, that they should have an area for only the unvaccinated and one for the vaccinated, or require you to be vaccinated to come. And that's not my decision to make. I mean, I think that's not what we should be doing. So I'm not going to, you know, I'm not going to tell these businesses they should do it or they shouldn't do it.
Governor, next question is the last question for today, and it comes from Luis Gill at Ohio Latino TV Online.
Hello, Governor. Can you hear me?
I can hear you and see you.
Well, I was last, and two of my questions were asked by Marty and Adrian Robbins, which is great questions. So I have one question left for Lieutenant Governor. And unfortunately, I had to bring back the backlash that you received from the Asian community. But my thing is that I believe that you did not say anything that was out of place, out of context, because literally, this is where it came from. But one of my questions I have is, the Asian community is so worried about what you said, what they have to say about the China regime for, you know, the Taiwan island, you know, being very forceful there, and especially the China regime controlling the Venezuela dictatorship down there, and displacing almost 5 million Venezuelans in the last 3 years. I don't believe that there's something that they have not responded or have any comments about it. What do you take on that, Lieutenant Governor?
Well, I appreciate the question. Look, anytime you get into these conversations, first of all, you have to create clarity, the clarity about what we're really talking about. What I was talking about is the responsibility I believe the Chinese Communist Party has to be honest about the origins of the coronavirus that killed nearly 3 million people worldwide, that there needs to be an investigation. The 122 countries since that time have also said they believe there needs to be an independent investigation. And we just need to call people to account, because in a global society, there are global impacts of what individual countries do that are affecting people in our country and around the world. And once we had that conversation, and once everybody understood that my comments were focused on the Chinese Communist Party and the actions of their government, and that I join them in denouncing violence toward anyone, and I am offered to volunteer awareness about the fears that exist among some in the Chinese American, Asian American community regarding increase in violences, and how we need to be a more civil society, and how we discuss these issues and how we raise them, and build a sense of community and awareness across cultures, so that we understand each other better and what our goals are. But having said that, to your question, there is no doubt that the Chinese Communist Party is impacting nations around the world in ways that are inconsistent with the virtues of American democracy. And so we just need to be aware of that. We need to educate ourselves as a society. We need to know how it's impacting our nation, and to be smart about it, to be clear about it, what we're talking about. And I feel like those conversations were very constructive and good, and that everyone I talk with is much better for having had them. So thank you.
We want to thank Cleveland State again for hosting us, hosting these vaccinations. We want to wish the Browns and the Bengals good luck on the draft starting Thursday night. Thank you very much.